All right. So before we get into the specifics on how to treat acupuncture points, here are some general rules. Okay. First of all, I will show you how to find the points on the basis of four, parameters. First of all, it's called same body measurement. See, I cannot tell you to, find a point that's like, oh, how many inches from here, because somebody tall, somebody short, that will be different. Okay. So many times I would say, oh, 4 finger width, from the elbow or from this to that. Okay, your fingers. So make sure it's same body measurements. Number 2 is anatomical landmarks. I would say, from the tip of your nose, or from this bone. Okay, so those are landmarks. You can feel it. Okay, from here, how far do I go to find the point? Number 3. Okay, in fact, the term acupuncture point is a misnomer. These are actually not points. They are depressions. In Chinese, the term is 穴位. 穴 means cavity. So more often than not, these points are located at a cavity in the bone structure, or the cavity or depression between the bone and a piece of muscle, or even between 2 muscles. So a general, rule is that there is depression, 穴位. But perhaps just as important is your own feeling. Okay, if you push on an acupuncture point, you will get what's called the 得气 feeling. 得气 in Chinese means got qi, like, oh, I got qi. Okay, so if you press on that point, you have a 得气 feeling. What is the 得气 feeling? The 得气 feeling is kind of like a mild ache. Okay, somewhat like a mild toothache or something, not sharp pain. Oh, ouch. Okay, no, it's like a very dull, achy feeling. It's very unusual type of feeling. And if you move the finger away, you don't get that. And put it back. Oh yeah. Okay, so you are as much a judge on whether you got the right point or not. When you push on these points, you get the 得气 feeling. Now, some of these points you push, you don't get that until you advance, so you don't keep pushing. Okay. But most of them you push, you get this kind of dull, achy feeling. It's not painful, it's just like a dull ache. Okay? Now, when you push on these points, how long? A minute, 2, okay. 3, that's okay. Okay. I already said to you that you cannot overdose, okay? Because whatever you do will set you to the normal state. But within reason, you don't want to do this 10 hours a day, okay? Then you may get hooked on your own endorphins, okay? Because I've seen people wearing these bands, okay, from Rite Aid or Save-On all day long, because they feel so good they don't want to take them off, because they have a sense of endorphins, which is the type of opiates. So now also you want to be relaxed, because many times these points are between muscle groups and things. So you may have to sit down or lie down, because like I'm standing, these muscles are used, and these points cannot be reached because the muscles are tight at the deep inside. And to help you relax, just like you've been hearing from other lectures, you breathe deeply and slowly. That will just generally relax you and make the points more accessible. So whether somebody's doing it to you or doing it yourself, breathe slowly and deeply, and concentrate on the 得气 feeling. Okay, so you don't want to do this while watching, CNN news or something, nothing like that. Okay, that will not be as effective. Number of times you can do it, I would say as needed. Okay, your shoulder is sore, you'll do it 2, 3, 4 times. Also, without saying every time, when I say, okay, if you have sinus problems, do this, okay? Actually, what I mean is, if you do this, you will relieve sinus problems, and you will prevent. So it's treatment or prevention thereof, okay? When I say this will kill pain, you do this, you kill the pain, but prevent pain from coming in the first place. So I don't want to like keep repeating myself. So I said, you know, if this, you have this, do this, you do this. But if you do this when you don't have the problem, it will prevent you from having that problem. When I say you do this, it will freshen up your tired eyes. Well, if you do this before you have tired eyes, well then your eyes are not going to get tired. You see what I mean? So if you are already pretty, you do this, it'll keep you looking pretty. Okay. If you're not, you do this, it'll look better. Okay. Now, but maybe as a disclaimer, I would say in advance, like everything else, okay, if you overdo it, okay, I cannot be responsible. Even though I said you cannot overdo it, because you can never judge how much people can overdo something. But perhaps more importantly is still a lot of the benefits I'm going to tell you are extrapolated on research on acupuncture. So yes, we know when you put the needle there, okay, UCI, put a needle there, that will decrease your blood pressure or set it back to normal. There's actually no equivalent clinical trial saying if you press, okay, but it just makes sense that if you put the needle, you know, push, the mechanical stimulation, but the research actually does not always get carried to the finger pressure. So a lot of the things I say, what's the benefits? The benefits are according to traditional Chinese medicine. So yes, you know I'm trained in both Chinese medicine and Western medicine as well. But in this case, most of the things I say are based on traditional Chinese medicine. There's not that much, you know, in terms of data from Western medicine to verify that this is really true. So I can tell you this. On the other hand, so for thousands of years, why would people do that if it doesn't work? Okay, so that. On the other hand, there are recent, you know, reviews, like in Cochrane review, reviews published in BNC, Complementary Alternative Medicine. They review many clinical studies and show that, in fact, finger pressure does help very much in situations of pain relief. Okay, does help very much in terms of improving sleep, calming people down. You know, those in fact I showed you some of the data. On the other hand, if it's just finger pressure instead of needles, just by itself it may not be enough. So the recommendation is that you do this and that, and in addition, do the stretching exercises I taught you like 2 months ago, do the Tai Chi, you know, I taught you 4 months ago, and so you said it's an adjunct to other treatments, then it will be, you know, more effective than just by itself. And finally, a number of studies show that pushing on acupuncture points is far more effective than general massage, you know, the Swedish massage, you know, this sort of stuff. That will be good, but, you know, acupressure is superior to that. Okay? So these are the general rules. All right, so you all ready? Okay? Ready, okay? So, first of all, the 3 gates of life, okay? 三大命门. So there are over 360 major points, okay? But 3 have been isolated as the gates of life, the most important, okay? So let me just teach you that first, all right? So now the first several, I'll just do it myself, it's easy. Then the ones that I couldn't do, I have my good friend Margaret to help me finish, okay? So 3 gates of life without any particular order, okay? And you will quickly recognize why these are the 3 most important. So, first of all, the one I talked about, okay, relief of pain, okay? Relief of pain, this is called folded belly, 合谷, okay? Now, how do you find this? Yeah, you can see. How do you find this? This is your index finger. And this is a joint. Okay. The continuation of the index finger is a bone that goes up to here. So from here to here is a joint, right? So this is proportional to your body, okay? Exactly halfway, okay, between the 2 joints here. That's the bone, okay? But it's called the folded belly, 合谷. So between this bone and this bone, that's the continuation of the thumb. It's a valley. See, it's soft. It's a valley. Okay. So the technique is if you have your hand like this and slide the thumb, okay, at the halfway point of the bone, slowly and slowly into the valley, and now press hard. You feel kind of a dull, achy feeling. Huh? Okay. All right. So again, halfway between this and this end of the bone, okay, slide your finger halfway into the valley and press hard and harder until you get that feeling. Okay, that's folded belly, 合谷. And in some of these studies I showed that you can relieve pain. You press on that, your brain will get a signal, and the brain will send endorphin itself all over the body through the bloodstream. So that will relieve pain systemically, okay? Whether you have a toothache, or you bump your knee, okay, or you got stung by a bee, it's all good, okay? It will just relieve pain because it's like getting a shot of morphine, okay? Except that the morphine is from yourself. It's called endorphins. Okay, isn't that important? Okay, so relieve pain of all sorts. Folded belly, the first of the 3 gates of life. Okay. Number 2 of the 3 gates of life. Inner gate, 内关. Okay. 内关, 3 fingers, okay, at the middle knuckle, okay, middle knuckle here, okay. You want to line up the 3 fingers with a major crease that divides the hand and the forearm, okay. So put it like this, okay. You see the 3 knuckles, like this, and on the other side, like right here, okay. You feel 2 tendons, okay. Between the 2 tendons is inner gate. Now, this is one where when you press hard, you don't get the qi feeling, okay? So just use your thumb and press on that point, okay? You don't really feel the pain, okay? What would this do? This is the study that shows that if your blood pressure is too high, too low, you'll normalize, okay? But also, I showed you for like $7.95, you can buy this wristband that puts pressure there. It will decrease nausea. So, like if you go fishing, or you go ride the boat to Carolina on a windy day, or ride the back of the car going to Lake Elsinore, okay, put pressure there, okay. You can take Dramamine, but that will knock you out, okay. But this will set you to the right level. At UCI Oncology, okay, patients undergoing chemotherapy, radiation therapy, they have the option of getting acupuncture right there. Okay, at UCLA Cancer Center, same thing. Okay, so this is a very important point. It's on the pericardium, meridian that has to do with the heart. Okay, so put there. Okay, this is inner gate. Okay.
The other hand.
Oh yeah, everything is both sides. So balance on both sides. Yeah, so if I didn't say so, it's both sides. The ones that are only one, they actually run right down the middle. So you don't have two sides, so it's right down the middle. The third one is called foot 3 miles, 足3里. That one, you have to relax and sit down. You cannot be standing up. Okay. My kneecap, okay. Here's my kneecap, okay. 4 fingers width, okay, from the bottom of the kneecap down, okay. So I feel the shin bone, okay. It's not on the bone. I said, shear weight is like in the depression. So between the bone and my muscle here is a trough. Okay, this piece of muscle, here's the bone. Okay, this is a point. Now, I mentioned how acupuncture points could be just a few millimeters away or very deep. This is very deep. Okay, how deep? You have to have a needle going almost an inch deep to get to this. In research at UCI, we showed that this lies right on top of the deep perineal nerve. Okay, so to stimulate the deep perineal nerve, you have to go down very deep. So if you just push like that, you're not going to be able to put enough pressure. So what I do is, you see, I put my thumb on this point, and I grab the back of my leg, okay, with the fingers. That's not enough. I use this thumb, put on top of this thumb, okay, 2 thumbs, and press hard, okay, and oh, I feel the dirty feeling, okay.
It's to the outside.
Outside of the shin bone, between the shin bone and the muscle, okay. Now, don't push too hard yet, okay. This is 足3里 is on stomach meridian. It's number 36. Okay, stomach meridian. So research have shown that if you push at that point, your stomach will start to churn, and you can electrically record, electrical signals in the stomach. For trivial reasons, okay. If you have constipation, you better be sitting down on the toilet before you do this. If you have diarrhea, yeah, this will help as well. Okay, so stomach 36. But, okay, all kidding aside, not kidding, I mean, that's for real, okay. So for digestive problems, okay, mention that point. But the last lecture, those of you who were here, is a quiz, okay. Your immune system has a lot to do with stomach and intestines. Remember, probiotics will decrease diarrhea, okay, and so forth. So, research has shown that if you stimulate that point, your immune system can be elevated, okay. So if you have, a cold or something, it will help, okay. If you have serious problems, then that would not be enough. You need a needle. So 1, 2, 3, the 3 gates of life. So for specific problems to do with digestion, boost the immune system, pain, okay, heart, cardiogram here, okay, obviously very important. But then I say is to solve problems and prevent problems. So a lot of times when you go to an acupuncturist, no matter what problems you have, the doctor will put a needle here, put a needle there, just for good measure. Because if there's nothing wrong with you, yeah, who couldn't need a boost in the immune system and good digestion, right? And not get constipation or diarrhea. Do that ahead of time. Make sense? Okay. Next, in my experience, people your age, a lot of people have knee problems, right? Knee problem. So let's go to the knee, okay? I don't want to move the chair. This chair is just in the right position. Knee problems. So for treating knee pain or prevent, okay, the main points are the inside, outside eyes of the knee. 内外七眼, 眼睛的眼, 七眼, okay? So easy to find, okay? Here's the kneecap. Below the kneecap, the two like dimples, okay? Well, should we be using this already?
Yes.
You see that?
No.
Just your torso. Don't touch it. Okay. My good friend Ken will help. Because he's the one who will fit. 照这个地方。
你动到线。
你可以tilт，你可以tilт down。啊？
动到线掉了。
Yeah. There. Good.
有什么你坐这边来帮忙好了，不然那个下面。Here's the chair. Here's the chair.
I go, yes.